we have some time for some discussion. I think we're already having some general discussion, but George, I didn't know if you had any remarks at this point to kick us off in the discussion, or.
I can see that it's always very nice to see the efforts of the countries that have been doing for especially marginalized population. And I perceive this situation as extremely optimistic, in an optimistic view, because when we started drafting the elimination targets for 2030, one of the obstacles that we had in Europe, but also in other countries, is what are we going to do, what governments will do eventually with marginalized population. And back then, the conversation about, prisoners and conversation about, people who use drugs, it was very intense. And we had the guidelines. We had a need for the scientific community to intervene and say specifically in the guidelines that people who use drugs are a priority in order to achieve elimination. This was a signal for governments. So now it's very nice to hear that, all these countries around the globe are doing such a fantastic work. And of course, the good news are over. We need to struggle a lot more in order to achieve our goals, and we need to focus. And the other remarks that I have is that, as we see through the example of Georgia, Georgia is a very important example, which had all the funds that one can ask. And even though they couldn't achieve the targets that they had, which means that, it's not a matter of money. It's a matter of, public health, political will, and changing the way that we are doing stuff in a completely new way, one-stop centers, etc., etc., etc. So I think all this discussion and all these examples from around these countries are extremely valuable. And I think all the lessons that we take, we could, think of them and continue our efforts.
Yeah, I think bringing this all together, as I mentioned earlier, I think we can really, help put together a toolbox of some of these strategies that we're hearing about this afternoon. Marcello, I didn't know if you had any other thoughts from your, no. Okay. Yeah, Tanjiro.
Thank you, John. I would like to sincerely appreciate you for the beautiful presentation. And I think this is probably what we at the World Hepatitis Alliance had always advocated for, to strike the connection between the community and clinicians, and then to see how we could get clinicians to become advocates so that we all together co-create this, attain this goal of elimination of hepatitis. So I think it's a good practice to see that the GPs and other clinicians are involved in the screening and linkage to care. However, the only concern I would have is with the goal of WHO to see simplification of services. Will that not be a challenge where people have to still be referred to the specialist or the hepatologist, right? That is the only concern I have, but I think it's important to really bring clinicians to the table. Then also, John, the global community set targets for 2030. And I remember even the SDG goals, certain LMIC countries started complaining that they cannot achieve those goals, very ambitious goals. So it is good to set ambitious goals. And like I think Georgia, they kept measuring and then re-evaluating what they're doing and motivating themselves to do more. So yes, it's beautiful. We have the goals, and 2030 is just by the corner. 2025 is a midterm evaluation of these goals. So we need, as Alliance, and I'm happy, John, we've always had these good collaborations and country programs. We all need to speak with a collective voice to get this political action beyond political will. We need to move the needle. How many countries are on track to achieve elimination of hepatitis by the 2025 midterm evaluation? Very few, maybe not 3 or 4. In LMICs, probably only Egypt, if it is even LMIC. So collective action, collective voice, bringing everybody together, clinicians, policy, patient groups, probably we might begin to hopefully talk about elimination, but I just hope that we get to achieve elimination of hepatitis, hopefully. Thank you.
fully agree with that, except to emphasize, instead of just really heavily focused on we're not on track to reach a goal, hopefully you can see some examples today of we are on track in many ways of putting in place the services needed to achieve elimination, and just really sort of stick to what's immediately in front of us, rather than all this projection of what's not going to happen by a certain date. I think it was demonstrated here, at least for me, that there's a lot of good work going on in these countries. There's some real role model strategies going on, and we need to promote those and share those so that others can take advantage of that and really show that this is fully a feasible exercise that's going on. And you got incredible program in Lithuania that, they're keeping it simple, but they've really sort of hit the magic target of what really motivates testing. As you pointed out, that all important linkage to treatment really has to be strong as well. And so how did that happen? That came up in the Romania too, there's still a pretty sizable percentage of people not yet treated, even though they've been diagnosed. So we have to look at that. But what we learned from Ukraine, they continue to develop and support their program amidst high stress from being attacked by another country. So we really want to thank you for your work, and let us know that we're supporting you in your efforts for hepatitis and just in general, for a successful outcome to what you're experiencing. Moldova, a very small country, but really well-developed program. You have an immense set of information that you put together, even though you think you need more. You really gave us some great examples of tracking progress in testing and doing a lot with treatment. And so it's really was great to see, and it's great to have been part of your work. So thank you very much. And then, as we mentioned for Georgia, for Maya, really shows how a program continues to evolve, and how you have to change your strategies as you move along. Moving from a very focused, centers of treatment to more broad-based, simplification of care throughout health systems, moving to improve prevention, such as moving to virologic testing for blood donations. That's not done in very many countries, even now. So it's just really that continued focus on quality improvement to reach that goal, and then once you show that you're successful, even though you may not hit that initial target year, you've got that buy-in to your program for people to move on with you to that new target year. And I think that's what was evident for me. And then for Romania, the country and the European Union with the largest burden of hepatitis C, just the amazing program they're putting together to engage more, promote more testing, get treatment paid for, have a data system in place to track progress, and really showing how the importance of hepatologists and specialists to step out and really become a community and public health focused, and have a public health approach to move beyond specialty care, to recognize how you really have to disseminate that. And we have an opportunity to do that because of the simplicity of hepatitis C treatment. And then the challenges for Poland, a low burden country, but they're well aware of what needs to be done in Poland. And maybe we can have some follow-up to see how we can help you have some strategies to better engage your primary care practice and get more national engagement for you. And look forward to helping you develop a profile for Poland as a step toward that goal. And then Lithuania, as I've already mentioned, is just an amazing program. And so I feel very energized about the whole afternoon, and really feel very fortunate to be part of a global disease elimination program that's going to be successful. And I want to thank you all for being local champions for hepatitis C elimination, because that's what really makes it all come together. So I want to just thank you so much for your doing the work and being the strong voice in your countries and strong delivery of services that's making these achievements possible. We still have a ways to go, but progress is being made because of the work you're doing. So I want to thank you very much for that as representing the coalition. You have any final thing? Anything else? Any other comments? Anyone? Great. Okay.
Thank you. I don't want, this is not the last word, but I was really, I'd like to congratulate Lithuania really from my side as well. And there was a sentence that touched me a lot. Make it simple. Really, this is the main word that I think has such a power. Because in my country, Slovenia, this is a 2 million population, and we started very simple more than 20 years ago. This was a self-founded interdisciplinary group of experts. In 1997, we did a very simple strategy on 3 pages, no paperwork, administrative work, meetings, time and money consuming, as you said, and we just started to do it, you know, and now we have the lowest prevalence, like it's 0.07%, so we are nearly there, you know, but simplicity, and congratulate you on that. Of course, you need a political and country support, that's for sure, but anyway, make it simple. I think that's the word.
So, sorry, John, just a last word from us, and it's just an appeal to everyone to please work with community groups, identify strong patient groups. The people-centered care needs community involvement, and I think I'm happy when I saw Georgia and other countries really working with community groups. So in all the countries, we have like Alliance, we have members all over, so it's very important to involve community groups in all the activities that are going on. Thank you.
Yes.
We only wanted to thank you for the invitation, to thank all the partners. I think we can be partners in the future. We also thank for the support for Ukraine, as Ukraine, as you know, in our problems. And we also solve the problems and obstacles in other countries, and we see the points of the growing for us. So I think it was very interesting, and it was pleasure for us to be a part of this family. I hope we will be family in the future. Thank you.
We are a family, that's for sure. I just wanted to end, we put together, if there's no other comments, just put together a call to action up front after, talking to the presenters and seeing their presentations. Just hopefully you can, agree with this. I think our takeaways were, some calls to action, focus on marginalized populations, to scale up the services for equity, scale up community and clinic-based testing, to screen and diagnose hepatitis C before they develop severe liver disease, as we were seeing in Romania, for example. Expand access to hepatitis C treatment through simplicity, as we were just remarking on service delivery, and that can take many forms, and Lithuania provided one example of that. Strengthen information systems, we heard that from multiple countries, the value of data, and the importance of getting the information systems to understand where you are in your progress toward elimination. Increased collaborations across clinical specialties. We focused a lot on primary care today, but there are others to really get this to be an all health system approach. Infection control continues to go up. It was a problem for Lithuania, came up in Romania. So we don't want to, we always want to remember that the most common mode of transmission of HCV continues to be in healthcare settings. And we have to continue to improve infection control. And we've talked very much about strengthening national commitment in the country, such as Poland, and to see and whether they need help with a budget-based planning, to see the value, improve strategic planning, the involvement of community-based organizations to make this a civil society priority, just the importance of national commitment. And then through all of that will be helped by raising awareness through all these different stakeholders. So does everybody agree with that? So thank you very much. Please sign on if you agree with it. A copy of that QR code. Please keep in touch with us. My email is jward@taskforce.org. Please, please come to our website, sign up for our newsletter. We put out a weekly news summary for hepatitis elimination. Look forward to working with all of you to advance progress toward hepatitis C elimination. Thanks again. Take care.